So now we are going to read composition of IV fluids. Some of the IV fluids which are very important. We are going to read what is their composition. Okay. So why is it important to know the composition of IV fluid? We can leave it like that? No, because there are basically three types of fluids that are required in the body. One is the maintenance fluid. Okay, this you should know just for a brief introduction. Maintenance fluid, second is the replacement fluid, and third is the special fluids. Okay, so what is maintenance fluid? Maintenance fluid is that fluid when we replace which is lost from the insensible fluid losses like lungs, skin, feces, and urine. Okay, so the insensible water loss is approximately 700 ml normally. This is the maintenance fluid. So, what is the fluid that can be used? Since these fluids are low in salt, then you can use either 5% dextrose or 5% dextrose with half normal saline. Okay, or 0.45 normal saline concentration. These two fluids you can use as a replacement fluid. Replacement fluid means if you are having losses from somewhere, like if a patient is having vomiting, diarrhea, intestinal fistulas, infection, burns, then the fluid which is needed is called as replacement fluid. Commonly used fluids are normal saline, Zinger lactate, isolates, various type of isolates which are rich in potassium, MPG, MPG. These can be used as replacement fluid. And special fluid, if patient develops hypokalemia, then what is the fluid that you need? Either you need facial ampules. If patient develops hypoglycemia or hyperglycemia, okay, then in case of hypoglycemia, you can use 25% or 5% dextrose. In hyperglycemia, what are you going to use? You can use 5% dextrose or normal. These fluids are preferred in diabetic patients. Okay. A quick recapitulation of what we already discussed is the maintenance fluid, replacement fluid, and special fluids. Now we'll discuss the composition of few IV fluids. First is the 5% dextrose. So what is the composition of 5% dextrose? I already told what the given percentage, you multiply it by 10, the same the concentration in milligram per ml, 50 milligram per ml of dextrose. Okay, so you can write either as 50 gram per liter dextrose. So this is the composition of 5% dextrose. Second is the 25% dextrose, 250 milligram per ml is equal to 250 gram per liter or 2. So a quick recapitulation of what we already discussed about maintenance fluid, replacement and special fluid. Maintenance fluid is that fluid which is replaced for fluid lost from lungs, skin, urine and feces, and the replacement fluid for fluid that is caused by losses such as gastric drainage, vomiting, diarrhea and fatigue, and special fluid in conditions like hyperkalemia, hypoglycemia, and metabolic acidosis. Next is we are proceeding for the topic composition of IV fluid. Now the first fluid is 5% dextrose. 5% dextrose multiply the percentage by 10, 50 milligram per ml, or you can write it as 50 grams per liter. Okay. Now the next fluid is 0.9% normal saline, means 0.9 milligram per ml, means 0.9 grams per liter. सो अभी हम पढ़ेंगे कॉम्पोजिशन ऑफ आईवी फ्लूइड। जो पहला फ्लूइड है वो है 5% डेक्सट्रोज। 5% डेक्सट्रोज, जैसे कि हमने पहले पढ़ा, 5 को 10 से मल्टीप्लाई करेंगे, ये हमें इसकी वैल्यू देगा मिलीग्राम पर ml. ओके, 50 milligram per ml, or you can write 50 grams per liter. Similarly, next fluid is 0.9% NaCl. Normal saline 0.9%. You multiply it by 10, 9 milligram per ml, or you can write it as 9 grams per liter. Okay, 9 grams per liter. And as you already know that 1 gram contains 17.1 milliequivalent of sodium. 1 gram of NaCl salt contains 17.1, so 9 gram will have 154 milliequivalent per liter of sodium and 154 milliequivalent per liter of chloride. Okay, sorry. Third fluid is dextrose normal saline. It has 50 grams of glucose, 50 grams of dextrose plus 154 milliequivalent of sodium plus 154 milliequivalent of fluoride. Okay, this is in 1 liter per liter. Okay, now the fourth fluid is ringer lactate. Ringer lactate is very physiological fluid. It is like sodium concentration is 130, potassium concentration is 4 milliequivalent per liter, chloride is 109, lactate 28. This lactate converts into bicarbonate. Okay, so lactate 28 and calcium 3. So this 3 milliequivalent per liter. So it has all important components. So RL is physiological fluid. So this is the isolites. Isolite fluid, they all have PMG and E. They all have dextrose, sodium, potassium, lactate. Okay, so dextrose, amount of dextrose is filled in them. It is about 50 grams per liter. Amount of sodium, potassium, chloride, acetate and phosphate value. Okay, so this isolite M has maximum amount of potassium. Okay, isolite P, this one has 20 milliequivalent of potassium and it has 35 milliequivalent of potassium. So isolite P is a fluid which is given in case of pediatric population. Okay, and there are fluids, जैसे isolite G is the only IV fluid which corrects metabolic alkalosis because it has ammonium chloride. Ammonium chloride gets converted into hydrogen and urea in the liver, and its addition corrects the metabolic alkalosis. So isolite G is the only fluid which can be used in, if somebody asks which fluid is used in metabolic alkalosis, it is isolite G. Metabolic alkalosis. Okay, and the fluids which are rich in potassium, one thing is to know that they should be avoided. Potassium containing IV fluid like P, M, G, E and the ringer lactate are avoided in cases of renal failure because the potassium level increases in these cases because since the failure of kidneys, it cannot excrete the extra potassium, so it causes hyperkalemia. And in liver failure also, two fluids which should be avoided are the ringer lactate and the isolate G. Because isolate G, there is ammonium chloride and it gets converted into hydrogen ions and urea by the liver. In liver, the processes are hampered, so isolate G leads to accumulation of ammonium chloride. Similarly, ringer lactate, the lactic acid metabolism um, is hampered in the liver, so lactate gets converted into bicarbonate by the liver diseases, lactate metabolism is dead and will lead to lactate 3% NaCl or hypertonic saline. Okay, sodium concentration in this is 513 milliequivalent per liter, but a small amount of fluid is used in case of replacement for conditions like SIADS, syndrome of inappropriate antidiuretic hormone secretion, or water intoxication along with furosemide. Okay, these conditions this fluid is used, it comes in 250 ml bottle. So it is used in these conditions.